So my name is Ahmad Harb, and I'm here with Kinley Buckley. We're doing a presentation here for ultrasound of the lower extremities to um, evaluate and diagnose deep vein thrombosis. Uh, so objectives of this talk is essentially understanding the indications for POCUS, reviewing some of the general anatomy, some of the landmarks that you may see when ultrasounding the lower extremities, understanding how to position the patient, what probe type to use, and the different approaches. There's a few different techniques in evaluating DVT, uh, as well as understanding how to diagnose and reviewing some of the pitfalls that you might face. So indications, relatively straightforward. Is, if you're suspecting that somebody has a DVT, and what that might mean is you'll see on physical exam or history that patient has unilateral leg swelling, erythema, pain, uh, uh, or present. They may have a history that might point to increased risk of thrombosis, like malignancies, immobility, long bone fractures. Um, and then, of course, physical exam signs that might point to like a pulmonary embolism, such as tachycardia, reduced oxygen saturation, tachypnea. Of course, in the setting of a PE, you would want to evaluate the lower extremities for possible DVTs as a potential source. And then, shortness of breath, chest pain, also signs of PEs that might have resulted from DVTs. Some venous anatomy. Over here on the right is a pretty good image of what you'll see, depending on which portions of the thigh and the leg that you are ultrasounding. Some of the important structures that we'll be looking at a little bit later in this lecture is, um, there's a common femoral vein. So just kind of going superiorly and then more distal down the leg. So you'll see that the external iliac actually um, uh, will branch into the common femoral vein and then also the great saphenous vein here. But one of the first images you might find is here at point 1. You'll see common femoral vein. Whoops. Common femoral vein and common femoral artery. You'll note that the common femoral artery is lateral, typically lateral to the vein when looking at the leg. So here we're looking at the left leg, and the arteries within the thigh generally are going to be more lateral. One of the exceptions here is going to be the popliteal vein and popliteal artery, which I'll talk about in a moment. But so going from superior to inferior, the first image you might find is common femoral vein and common femoral artery. Eventually, the common femoral vein will branch off into the great saphenous vein here, which is draining into the common femoral vein. And then a little bit distal to that, here at point 3, you'll see that the common femoral artery actually bifurcates into the superficial femoral artery and the deep femoral artery. And then a little bit distal to that, eventually the common femoral vein also will bifurcate into the superficial femoral vein and deep femoral vein. And you'll notice that these structures, they tend to run next to each other, the vein and the artery. And again, the artery is more lateral. Of note, the superficial femoral vein is a little bit of a misnomer because it is technically a deep vein. And if you were to see a thrombus in there, it would be considered a DVT. But I've seen that the superficial nomenclature has actually been removed for the most part, and now it's just being referred to as femoral vein to reduce that ambiguity. And then a little bit more distal around the knee area, and you'll find the popliteal vein and popliteal artery, and we'll go over where exactly you'll be placing the probe. But in this is the only exception to how you kind of evaluate, in that you're actually looking at the popliteal fossa in the back of the knee when evaluating the popliteal vein, as opposed to these other structures in the thigh where you're kind of looking more anteromedial on the leg. And then the popliteal vein, it's not shown here in these images, but the popliteal vein does eventually trifurcate into the anterior tibial vein, posterior tibial vein, and peroneal veins. So just general rules of thumb, as I mentioned, the arteries tend to be lateral to the veins, and then the popliteal vein is typically posterior to the popliteal artery. But what that means for our purposes is when you're evaluating it, remember that we're looking through the popliteal fossa in the back of the leg. So the popliteal vein being posterior just means it's closer to the probe on the image. So patient prep, essentially what you'll be doing is putting the patient in a frog-like position. So let's say you're imaging the right leg for suspicion of DVT. You have them essentially abduct and exteriorly rotate the leg with the knee bent like this at like a 90 degree angle. And then you can slowly go down from superior, scanning down the common femoral vein, which will then branch with the greater saphenous vein, and you kind of go down into the popliteal fossa. The probe you'll be using is linear probe. Despite the name deep vein thrombosis, when you're evaluating the veins and the arteries tend to be superficial enough where this probe would be able to image them appropriately, and you'll have a pretty good resolution in doing this. So some of the protocols and steps for DVT eval. When I was looking through, I did find a few different approaches. There's a 2-point scan, which is kind of a quick and dirty way of evaluating. Essentially, what you do is you look here in the common femoral vein region. You look about 1 to 2 centimeters below where the great saphenous vein is draining into the CFV. 1 to 2 centimeters below and 1 to 2 centimeters above. And then kind of the same thing here in the popliteal fossa. You look at popliteal vein, 1 to 2 centimeters above and below where it trifurcates into those 3 veins that we talked about earlier. Now, another approach is the 3-point leg ultrasound, as well as the whole leg ultrasound. So the whole leg, as the name entails, you kind of just run down the whole leg, evaluating the whole way through, looking at the great saphenous vein, common femoral, looking at the branch point where it becomes the superficial femoral vein, or as it's now known as femoral vein, and then the popliteal and all these veins. However, this 3-point leg ultrasound has shown similar sensitivity and specificity to the whole leg ultrasound, and it's relatively quicker because you're only looking at 3 points. So it's definitely one way that you might be able to evaluate at least quickly and with pretty good outcomes. So how do you diagnose exactly? So first thing, when you're evaluating the lumen of the vein, and obviously it's a fluid-filled structure, so you would expect it to be anechoic throughout. Now, if you were to see any echogenic structures like here, you could see there's kind of an echogenic structure here in the anterior aspect of the vein, whereas the rest of the vein and the artery and the great saphenous vein here all anechoic throughout. So this would be an echogenic structure indicating possible DVT. Additionally, let's say the clot is a little bit newer. Newer clots tend to be less echogenic, so this is probably a little bit of an older clot. But if it's a newer clot, you might not necessarily see that there's an echogenic structure there. And if that's the case, the next step would obviously be compressing. And you should compress regardless, even if you see the clot or not, just to evaluate further. But compressing slightly, not too much, but also not too little. What you want to do is try to find enough pressure where the artery is slightly compressing, and then you can evaluate the vein under that level of pressure. And if the vein is not compressing sufficiently, like here, you can see it's still pretty distended, then that's pretty indicative of a DVT as well. And lastly, in this one is take with a grain of salt, but so you can add color Doppler on top of the vein and squeeze distal to where the vein is to try to get flow and see if flow is going through the vein. What you would expect to see is that flow does go through, and you'll see that light up on color Doppler. However, there's a risk in that if you cause disruption of that area or irritate the area of the thrombus, you might cause dislodging, and that could lead to a PE, which of course would be not something that you would want to do. So ideally, probably just rely on the echogenic structures within the lumen and the compressibility of the vein. Unless you really, really think there's a DVT and you're not seeing any evidence, maybe you can consider doing Doppler. All right,
Okay.
Yep.
So I'm Kinley. I'll take over the second half. So we talked about this anatomy already, but we'll kind of go through it with this kind of the green pictures on the right to show where you're scanning on the person, and then on the left to kind of see what it looks like again, anatomy-wise. So when you're starting, again, like we talked about with the frog leg, it's kind of on the medial aspect. So this at the top, common femoral vein and artery. And then, like we said, the artery tends to be more lateral. So from the probe, it would be kind of the first one that you see at the top there. And then on the left image, you can see there's actually a thrombus in the vein here, and it gives you both axes, which is helpful as well. So you can kind of see that hyperechoic area within the vein here on the left side of it. And then when they go to the long axis, you can see it kind of continue longwise as a clot would in a vessel. Okay, so here's another picture of a DVT in the common femoral. So they have seen it called like the Mickey Mouse sign, with the common femoral vein being like the head, and then the femoral artery, and then the saphenous vein around the great saphenous being like the ears. But so the common femoral here, you can see kind of like that lucency, the hyperechoic white area right in the middle, indicative of a DVT. And like we said, sometimes the newer clots might not be as bright looking, but this one is pretty apparent. So then on our way down, here's kind of that where they've been calling like the Mickey Mouse sign again. So the head being the common femoral vein, and then the ears there, the saphenous vein, and then the common femoral artery. So as you kind of make your way down, you can just sort of see that that is where the great saphenous vein is bifurcating off of the common femoral vein. And then you can see it obviously on the ultrasound on the left as well. So then working our way down still, so then the great saphenous comes off of the common femoral, and then common femoral gives rise to basically the femoral vein as well as the deep femoral, and then here you see the femoral artery as well. So again, the artery kind of being the more lateral one there. Okay, so now kind of posterior knee is where you'll find the popliteal vein. Now you're kind of around like just kind of the backside of the patient's leg. And then there you see a nice view of the vein, the popliteal vein being more posterior. So kind of the first thing you see, the artery behind it or in front of it. And then you can see that the vein is compressing nicely compared to the artery there. Okay, so here's one of our examples. This is the popliteal vein. Basically, the question is that a DVT or not? And you guys can think about it for a second, but then we can talk about it. So here, you can kind of see that hyperechoic lighter area, and then you can also see that they're compressing, and it's not fully compressing. So the vein there should kind of flatten pretty nicely, and it's sort of irregular and uneven, and definitely not fully compressing where you see that clot.
And I'll add in that the artery here is quite significantly compressed, so they're pushing quite a bit, and the vein is still just distended.
Yeah. Okay, so then beyond the popliteal vein, that's where you get the trifurcation, where it actually splits into three with the anterior tibial, posterior tibial, and then the perineal veins. So you can kind of see that here with, again, the artery running more anterior. So the first kind of from the probe, the first three that you see are those three veins offshooting, and then the bigger artery behind it. So some common pitfalls. So of course, user error is always one of the big ones. So like we kind of already talked about, if you're not applying enough pressure, if you're not sort of sitting directly perpendicular to the vessel, then you might be kind of skewed to thinking, if you're not pressing hard enough, that maybe it's just not compressing, and maybe that's a DVT when it's not. One of the other things that can kind of confuse the picture, pseudoaneurysms. So like this picture here on the right, they are calling it the yin yang sign. So it doesn't always look this kind of neat and kind of like a perfect E-ing, but this one looks nice where you can see the red and the blue kind of in that shape together, which represents the bidirectional flow of blood within a pseudoaneurysm. So the red being blood coming towards the probe and the blue away from the probe. So that would be a sign if you put on the Doppler that that's not a clot, that's more likely a pseudoaneurysm. Some other things, Baker's cysts and lymph nodes, of course, can kind of cloud the picture with similar presentation, similar signs and symptoms of maybe a swollen, painful extremity. But one of the ways that you can kind of counteract that is by using the long axis. So something like a lymph node will more likely be sort of just that circumscribed around lymph node, whereas a clot in a vein kind of keeps that shape when you're going long-wise. So you'll see kind of that tubular shape in the long axis. So that's a good way to kind of differentiate it there. Same thing with like hematomas or other kind of blood collections. They shouldn't really follow that tubular shape like a clot inside the vessel is. And then superficial thrombophlebitis, of course, is something that comes up a lot, especially in obese patients, but just basically where you have, the same symptoms again, swelling, redness, pain, but it's not actually a clot in a major artery. Or vein, I'm sorry. And then, okay, so here, another question, DVT or not. So this actually, you can pause if you're thinking about it, but this actually is also the yin yang sign, not as orderly and neat as the other one, but still shows that bidirectional flow of both the red and the blue, representing the blood going away and towards the probe. So that is not a DVT. Okay, and then this is a nice video just so that you can see them switch it to the long axis. So this is actually the common femoral as well, and you can see that on the one view, the kind of Mickey Mouse sign again, and then you can see them turn it to long axis. So there is that hyperechoic kind of lucency that you can see in the common femoral, and then when they change it to the long axis, you can sort of see it extend and elongate like that tubular shape. So this is an example of a DVT in the common femoral. So then some key takeaways, kind of review of the main points that we talked about. So the linear transducer is what you're using for those kind of superficial structures. The frog-like position, so you're having the patient abduct and externally rotate and then running along the medial portion of the leg until you get to the popliteal, where you'll go sort of posterior to the knee in that area. Of course, starting from the top, scanning down, knowing your anatomy and kind of following along that way, looking for echogenicity within the vessel, as well as checking for compressibility. So using pressure enough to slightly compress the artery, knowing that that should significantly compress the vein. And if it's not, that is one of the kind of possibilities that maybe a DVT is there. Using both your axes, so the long and the short axis, to rule out other structures like lymph nodes, Baker's cysts, hematomas. Knowing that a clot in the vessel more likely will kind of elongate with the shape of the vessel and kind of appear more tubular instead of being like a circumscribed circle. And then using Doppler as a tool if needed, especially for things like pseudoaneurysms where you would expect to see that bidirectional blood flow. So then using kind of the Doppler flow and the red and blue to your advantage there. And then here are our references for the images and for the content as well.